Hi, everybody. Welcome to our discussion with Dr. Therese Simon on blood work tonight. I am Joanne with For Better, For Worse.
I'm Nancy Reyes with For Your Canine. I'm the little avatar tonight, for a little while anyway.
And I'm Lisa Bataska with Canine Defined.
So we asked Dr. Simon to come on with us tonight to not give you answers on your own blood work, but basically, right, we just wanted her to share when veterinarians are looking at blood work or you are looking at your printout that you've gotten done at your vet office. What do all the letters mean? What does it mean if it's inside the bars or outside the bars? What groupings go together? And things like that, just so you guys can be a little more well-versed on what the printout means, what you see, when you get it. And that way you can maybe have a better conversation or ask more questions with your vet in the office or calling them back. So, Dr. Simon, would you like to introduce yourself a little on your background?
I'm Therese Simon. I work at the Minooka Animal Hospital in Minooka, Illinois. Tomorrow will be our 25th anniversary of when Minooka opened. And I've been doing it for 30 years. I went to Colorado State. Go Rams.
My nephew's going there right now. It's his freshman year. I didn't know you went there.
Oh, yay.
Unrelated. Sorry. Okay. So I think kind of like on an average day, I'm sure you do a lot of vaccines and things like that. Like on an average day, how many blood panels do you run?
Oh, it depends. It could be 2, it could be 8.
Okay.
Not including surgery, just on regular stuff. And there's either 2 or 3 of us doctors there at a time, usually. So then it can vary, with that too.
Okay. And can you talk about the different kinds, right? Like you can just have your basic, you can have, adding chemistry and differentials. Can you talk about the different, I guess, kind of levels of the blood that you might run?
So we usually, when we do a wellness panel, it usually includes the CBC, which is your complete blood count. So that's your white blood cells, your red blood cells, platelets, that kind of stuff. And then your chemistry panel, which is your diabetes, kidneys, liver, electrolytes, that stuff. That's your basic wellness panel, or even sick panel if we're worried about your sick dog. You can add thyroid. We were talking about that before we came on. We can add thyroid to screen. In-house, we can add just the screening T4 for thyroid. If we want to do a full panel, we send it out to the lab.
Okay.
Yeah.
Lisa, did you have any? Go ahead.
Yeah. Actually, so so I have a bunch of young dogs. I would like to have a baseline. If I were to do a baseline, what do you recommend in terms of what kind of labs?
That same thing, the CBC and the chemistry. So then you have the baseline of all of it, because that's all your basic blood work kind of tells us what's going on the inside. And then that way, in a year, 2 years, 5 years, we know what we were at.
And do you recommend doing those pretty annually or just to stay ahead of issues or concerns? What is your recommendation?
Certainly once they get to 5 or 6 years old, it would be great to do them annually. Every 2 years is probably okay till you get to, 9 or 10. Kind of depends on the dog. A Great Dane 9-year-old is different than a Poodle 9-year-old. Mm-hmm. And what people want to do or are willing to do can be different too, right? So we can recommend it, but whether it gets done or not, is up to them.
So before we get into the what's and whys, I have a question. So speaking of what people want to do, right? If you're doing just a generalized spay neuter or dental or something that's going to require anesthesia, they always recommend let's run some blood work first and make sure your dog doesn't have anything else going on. Can you describe kind of like what you would look for in that, just to like, what exactly are you screening for to make sure the dog's healthy enough to be put under anesthesia?
Well, so a few instances I've had where seems like a perfectly healthy puppy. Maybe they're 6, 8, 10 months old. We do blood work and maybe they're anemic. Maybe their platelets are low. I've had a couple where the liver values are quite elevated. And so then we put the kibosh on the surgery and say, all right, we need to investigate this further before we go ahead and do the surgery. And certainly if you were anemic or had low platelets, you wouldn't want to go through with surgery, because you're going to bleed. So.
Sorry, guys.
Can I ask a question? So,
Sure.
Therese, why is it important? Because I know, we, Lisa, Joanne, and I are a little bit, we're always on top of the medical thing. But why would it be important for someone to have a baseline blood work for their dog, for their young dog? Like I have done blood work on my young dogs. There's nothing wrong with them. But why would you recommend doing a baseline for folks? What does it help with as they get older?
Well, certainly there are some dogs that can start out with a little bit of a liver issue, maybe a congenital liver thing. And if we waited until they were older and they had an elevated liver stuff, well, maybe it already existed. You know what I mean? Or what is their normal? Maybe this dog runs low as far as anemia, maybe not like under, but in the range towards the low end. And so that's normal for that dog. So then we wouldn't necessarily worry if it was down at that end. But if that dog is normally pretty high, say with their red blood cell count, and now we do it and it's lower or in the low end of the range, well, that's not normal for this dog. So even though it's still in the normal range, maybe we need to look into that before it gets out of the range, going too low.
So, so basically you're talking about trending, right? So
Sure.
With that being said, like how frequently would you, right now I have a 6-month-old Papillon, and there are things that I'm concerned about in terms of Papillons, right? Like liver shunts and stuff like that. So for me, I wonder like how frequently I would need to test to make sure that's kind of monitored. Is it would you say yearly, even on a young dog, or every other year? Like, what is your recommendation? I mean, in the most moderate of,
Yeah.
Not for us freak shows, but just for normal people.
So for your Papillon, if you're worried about a shunt, if you did blood work now at 6 months and it was normal, you're probably fine. And then every couple of years is probably good until we get to be 6 or 7 or even 8 in the Papillon, since they're such longer lived, breed versus, like I said, the Great Dane. But if it's good now, you shouldn't have to worry too much about it.
Okay. So for certain types of, like for me, for liver shunt, I mean, it's a concern. Like PRA is not something you're going to be able to see in a blood situation, right? So certain breeds like have tendencies. So in his particular case, my question would be like, what am I looking at in terms of the blood? Like, what would it be indicative or questionable, I should say, in regards to potentially that being something to investigate further?
So if your liver values were elevated, especially in a young dog, you wouldn't expect that. And so then certainly if it was a little dog like that, and we were worried about a shunt, the next test would be the bile acids, which then would rule it in or out essentially. And then also abdominal ultrasound grossly looking for the shunt. But the bile acids would be your test that's going to tell you the most about it.
Got it. Great.
If your liver values were elevated to start with.
Sure.
So we're getting a couple questions rolling in. For dogs 12 to 13-year-old, 22 pounds, do you recommend blood work more than twice a year? Do you recommend it more than twice a year? Sounds like they're doing it once a year right now for dentals.
So twice a year is awesome. If you're watching something like we talked about trends, right? Our liver values are starting to creep up. Our kidney values are starting to creep a little bit. Then you might do it every 3 or 4 months. If you actually are having kidney issues, then you might do it every 2 months, kind of depending on how stable the dog is and what it is that you're monitoring or keeping an eye on the trends.
Okay. We had
But
another one.
most veterinarians are going to be super excited if you did blood work twice a year on your middle to older pets.
Okay, I'll do it.
Nice.
Once a year is great, but twice a year would be super.
We have one more, and this isn't really the blood work we're talking about, but I'm going to ask it. My yearling Akita was discovered to have major joint problems. Can a dog's vitamin D, magnesium, calcium, etc., be helpful to know for future treatment? And I know you don't want to get into specific cases, but where would a vet's office be able to run something like that? Send away for those types of things?
What did they list?
Vitamin D, magnesium, calcium levels.
So the calcium is on your regular blood panel. Vitamin D would be extra, a separate test, and magnesium would be a separate test. And I'd have to look up like how or where you send those. I don't know if that would be helpful in a joint issue in a young dog. I don't know.
Okay. All right. I'd be happy to find a canine ortho if that's better. Yeah, I mean, I would say if you're dealing with something to be joint and your current veterinarian isn't, able to help you, and orthopedics might absolutely be a specialty to go and see, right?
Absolutely.
Okay.
Especially if it's young.
All right. So, Lisa, Nancy, do you have anything else? Otherwise, I will pull up an example.
I do. I have one more question. Well,
sure.
And this is just for those people who rescue dogs, because one of the things that you could find on, you would have to ask for a thyroid test, right? It's not part of the regular test, right, Therese?
Usually, sometimes on a senior panel it's included, but it depends on the clinic.
Yep. Well, and the reason I'm bringing that up, because sometimes with dogs that have been in rescue, especially with some behavioral cases, I think that doing a thyroid test would be really helpful, because sometimes thyroid can be associated with some behavioral situations as well, which is another reason why I just thought of it for having a baseline, whether you get a young puppy or you have a rescue. But for a rescue, I would probably do something a little more. Like I'd include that thyroid test, because don't you think? Because sometimes there are some things that are associated with thyroid issues that affect them behaviorally, right?
Sure. Yep.
So I just wanted to kind of note that, because I had a young Indy, my little rat terrier. He started to develop some behavior issues, and it had everything to do with his thyroid. But I did the test after that. I thought it would have probably been nice to probably do it sooner rather than later, but I in hindsight, I didn't. But I thought that would have, especially for rescue dogs, since you really don't know their background or what they've been through and all that stuff. So yeah, I just wanted to kind of bring that up, because I'm like, especially for the thyroid, for the behavioral cases, sometimes the thyroid is a big participant in some of that stuff. So, all right, go ahead, Joanne.
Okay. We have one more, then we'll get into it. So guys, I know everybody here wants to learn. And so I'm throwing out the caveat again. I said it really early before everyone joined, right? I don't want to put Therese in a place to answer questions about specific cases, only because, right, that is truly unethical for a veterinarian to try and give you advice on a dog they've never seen.
Right.
So I'm not going to put her in that position, but I will phrase your questions in the best way I can, where she can give you something to take back. So if you have an anxious dog on trazodone and fluoxetine, what might you recommend to make sure those drugs are doing good in the system?
Usually we recommend annual blood work. There's nothing really specific that those two drugs are going to affect as far as liver, kidneys, that kind of stuff, like some of other medicine can. But anytime we're on chronic medications, we want to do annual blood work, make sure everything's kosher on the inside, just to keep on track of everything.
Yeah. And I would say if you notice any changes out of the ordinary, go see your vet, right? Because some of those drugs can cause blood pressure changes and things like that, right? So any changes, go in and get yourself checked out. So I hope that helps, Michelle. Okay. Let me share here. And I don't mind telling you guys, this is actually a blood test I just got done this week on my dog. It is a 4-year-old Doberman, the Bamster. So basically, Therese, I'm kind of going to let you navigate. So do you want to group them first, or do you want to go through them first, or what would you prefer?
Well, can you make it bigger?
I can try.
Maybe I can make my thing bigger. Oh, no, that was littler.
How's that? Then you don't really, oops. Oh, sorry, hold on. How's that? Is that better?
Yeah, that's good.
Okay.
All right, so the WBCs is your white blood cells. That's going to be the sum of all of the ones under it, the lymphs, the mons, the newts, the eos, the basophils. Those are all white blood cells. Your WBC is the sum of all those things. And then if you go down, so your red blood cells and your hematocrit, those kind of are the same kind of a thing. Your red blood cells is the number of red blood cells. Hematocrit is the percent of red blood cells in the blood. HGB is the hemoglobin, so that's going to be tied with those also. And then the MCH and the MCHC are the volume of those red blood cells. So those go along with it too. The PLT is your platelets. So that's your platelets is what you need for clotting your blood.
So Therese, can I interrupt? So what would be a problem if your white blood cell count was low or high? Same with the red blood cell count. What are some of the issues that you might be looking at if either one of those are below normal? I think of this, I'm looking at it, it looks normal, but if it's not, and I can't really see very well, so if I'm wrong, just tell me. But what it means if you have a low white blood cell count, or what it means if you have a high, and same with the red blood cell count.
So the white blood cell count, if it's low, we don't worry as much if it's low. But in like super bad infections or viral infections, that can be lower than it should be. But certainly you would expect if you have an infection or inflammation, your white blood cell count is going to be high. And if it's super duper high, like 30,000, 60,000, 100,000, then we're talking about your blood cancers like your leukemias. With your red blood cell count, if it's high, you can have that when you're dehydrated. But we normally worry about it when it's low. And that can be, so that would be anemia, technically, if your HCT was low. HCT stands for hematocrit. If that's low, then your anemia could be either blood loss, blood destruction, like your red blood cell destruction, or not producing red blood cells in your bone marrow like you should be. Does that answer, or?
Yep, that's perfect. Yeah, I just wanted to, yeah, because it's like, I know, it's really clear when it's in the right area, but if it's a little bit lower high, like what it could possibly mean. I know it's hard to tell exactly, but at least you know what you're thinking, what it might possibly be. That's the only reason I wanted you to kind of go, you know, kind of mention that, because sometimes it's hard to tell. Like, yeah, it's high or low, but for people, it's like, well, what could that mean? It's still not for sure, but it could mean these things. So thank you. That was great.
Yep. And did we get all the way through this?
So those are just having to do with your platelet. It's just more like the percent of your platelets and that kind of thing. We just really care about the PLT number.
So I'm gonna pick on this blood test, right? So and these are the ranges, right? And so most blood tests have the 3 segments here, and then the dark band it matches over here, and that's where it's gonna show up on your chart, right?
Yep.
So ideally, in a perfect world, everything falls in the middle somewhere. So can you help, like, when we see this, well, this whole section, like this 3/4 of it was over the line, right? So when you see these sorts of things, and I know we can't like get into everything, right? But when is it concerning over the line, and when is it like, oh, that's just, we'll watch it, that's nothing to be super concerned about in the day, just because it's 1 point over the line, unless you have tons of other things matching in the blood work. So can you kind of talk about that a little bit?
Sure. So like with your hematocrit, it's 1.1% above the line. That's nothing. And like I said, we worry more when that's low, because that's anemia. When it's higher, it can just be dehydration, a little bit of stress, and your spleen can contract and send out more red blood cells, that kind of stuff. So high, we don't really worry that much about. When we're talking about the HCT, the hematocrit, but it's more when it's low that we worry about. And a point or so low, like say this was a 16-year-old cat and its HCT was 36 instead of, just slightly under the 37. Well, that's probably fine for that old cat because it's old. But in our not old dogs and cats, we'd expect it to be more in the middle. Otherwise, and like we said, we're looking at trends too a lot of times. So if your HCT then was a little bit lower and a little bit lower and a little bit lower and a little bit lower each time we took the blood, maybe it is significant even though it's still in that range. But the high, we don't really worry too much about. And then the other things, the MCH and the MCHC and the hemoglobin, they kind of go along with the HCT. So you'd expect them to be a little bit higher if your hematocrit was a little bit higher too. So nothing to think about. There is one GI disease. They've changed the name of it. It used to be called HGE, hemorrhagic gastroenteritis, where basically they're pooping out, looks like raspberry jam or strawberry jam. It's pretty much straight blood. And a lot of times in those guys, the HCT is in the 70s or higher. And so sometimes we'll use that to help diagnose HGE. But for the most part, elevated hematocrit, we're not all that concerned about.
So for the HGE, and you're saying that the HCT would be more elevated in the 70s, is that correct?
I repeat? It doesn't have to be, but if you see that and you've got the strawberry poop, then
So could that be so you're saying that would be together? I actually have a friend of mine who has a dog that gets HGE. So to kind of predict, it's kind of interesting to, like, when you see it occur, it's hard to, diagnose, so to speak, until it actually happens.
right.
So would you have to have the blood test to determine during an episode or post episode, pre-episode?
Yeah, it's
Help
usually during.
during.
I don't know that because we don't have a crystal ball, so you're not
Right.
going to go, oh, my dog's going to have an episode in 5 days. Let's take the blood now and see what it is. I don't know that it would be elevated or not.
Right.
Because that doesn't happen, right? So it's that high HCT is during the episode is when we see it, and it helps us kind of go, yep, I think that's what this is.
Great. Thank you.
And then, Nancy, did you ask too, like, about the white blood cells, high and low?
I was going to ask a question about that too.
Okay.
So I think, like, white blood cells, really elevated white blood cells means infection usually, right?
Yeah.
Body's fighting something. So can you talk about how you use these to kind of determine what kind of infection you're looking for or fighting?
Sure. So if your white blood cells are elevated, if it's from infection, usually your neutrophils, the NEU, is going to be elevated. That's your main infection fighting white blood cell. Your lymphocytes, actually your LYM, could actually be a little bit lower in a stress response. Sometimes we'll see that lower. Your eosinophils, the EOS, sometimes if we have parasites, that'll be elevated, and your white blood cell might not, your WBC number might not be elevated. But if your eosinophils are elevated in proportion to the rest of it, that could be a parasite. It could also be allergies or an asthma type situation. Those white blood cells like to respond to that. The basophils, we don't really care so much about them. Sometimes they'll go along with the eosinophils, but they're not that exciting or important. But mostly your neutrophils are going to be elevated when you're talking about an infection or inflammation of some kind with your white blood cell count elevated.
Okay. Do you guys have any questions on the top part? Otherwise, I'll move to organs.
Move.
All right. All right. So, Therese, do you want to talk about what these are?
Sure. So your albumin is one of your proteins. You have total protein, which is on, if you look on the right side, the TP, that's going to be your total protein. That is the sum of the globulin, the GLOB, and the ALB, the albumin, which is at the top of on the left. So your total protein, again, if that's elevated, that can be a sign of dehydration, especially if your hematocrit is also elevated. And it might just be minor, like they just didn't drink much today before they got their blood taken, that kind of thing. Your albumin becomes important. Your protein becomes important because that helps to keep the liquid in your blood. It keeps the concentration in your blood so that the liquid stays in it, rather than if your proteins go low, then the liquid's going to leave your blood, and then that's when you might get fluid in your abdomen or in your lungs, that kind of thing. Specifically, globulin, if we see that a little bit elevated, that can be with inflammation or infection. If it's even higher, then like in the 8, 9, 10, then a lot of times that's a sign that there's cancer somewhere. It's not like a specific cancer predictor or assay, so to speak, but that can be elevated when we've got some cancer. Your ALP is, we consider it one of the liver values. Your ALT is also a liver value. Sometimes AST is on here also. The ALP, though, is not super specific. And so you can see that elevated with, in young dogs, it can be elevated with certain medication like steroids. It'll be a lot higher. Phenobarb, it can be higher. That kind of thing. The ALP can be elevated. In general, when we don't care if it's low, like we just ignore it if it's low. If it's elevated, it needs to be like 2 to 3 times the high end of normal. So the 150. So we'd want it 500-600 before we would really even worry about it. And again, it's not a very specific one. So we could take the blood today, it'd be 500. We could take it tomorrow and it might be more in the normal range and for no real reason. So that one can throw people off because a lot of times, say on BAMS, the ALP, the high end on this is 150, say it was 160. You're like, oh no, his liver value is elevated. I wouldn't even look twice at that because that's not even significant.
He was drinking the night before. It's okay.
Yeah, there you go. The ALT is the more important one. That's going to talk about liver injury to the cells in your liver. So again, on this one, the high end of normal is 118. If this was an old dog and it was in the 120s, 130, I probably wouldn't even look twice at it. But in BAM, if this was elevated, like say it was 150, 170, then we might want to look further into his liver, either with bile acids or an abdominal ultrasound or that kind of thing, because something is going on. Again, low ALT, we don't care too much about. The total bili, the T-bill, is that can go along with liver issues. That can also go along with if you've got the kind of anemia where you're attacking your own red blood cells. Inside, there's bilirubin inside the red blood cells, and that can be released when you're breaking down your own red blood cells. And so if you're anemic and your total bilirubin is high, say it was 3.0 instead of 0.3, then that would make me think, uh-oh, we've got an autoimmune thing where we're attacking our own red blood cells, perhaps. That being said, I have also had where the technician is drawing the blood and has too much suction on the syringe. And so then those red blood cells can get broken up as they get sucked into the syringe. So you could have a falsely elevated total bilirubin. But if everything else checks out fine and the dog is fine and his gums aren't yellow, then that's probably just artifact from the blood draw. And again, low total bilirubin, we don't really care about. I'm skipping amylase for a minute. The BUN and the creatinine, the CRE at the bottom, those are going to be your kidney issues or your kidney values. The important one being the creatinine. The BUN usually goes along with the creatinine, and the creatinine is the one that we watch mostly, especially if we're talking about kidney disease and we're keeping an eye on it and seeing what our treatments are doing for it. Sometimes with liver issues, though, your BUN can actually be low. So that might be something if your liver values were elevated and your BUN was low. That helps us point more towards the liver also. Like we said, your creatinine is your kidneys. When it's elevated, usually something's going on with your kidneys. And it could just be infection. It doesn't have to be actual kidney disease or something bad going on with your kidneys. but something is going on with your kidneys. And then the phosphorus usually goes along with the creatinine, because one of the jobs of your kidneys is to eliminate your phosphorus. So if your kidneys aren't working very good, then your phosphorus is going to be elevated. And a lot of times I think that's why our kidney failure dogs and cats feel so crappy, is because of the phosphorus is elevated. The phosphorus can also be elevated in a young dog, though. So if Bam was 6 months old, it might be 8 instead of 4.4. And then same with the calcium, that can be elevated with a young dog. The calcium, when that's higher, like the high end on this blood work is 11.8. If that was 13, 14, sometimes that can be a sign of cancer, because some cancers will create a malignant hypercalcemia. So that would be something we'd want to look into if that calcium level was quite a bit elevated. Glucose, probably you all know glucose, diabetes. If your glucose is elevated, if your glucose is a little bit elevated, it could be from stress. Cats are really good at that. If a cat has a glucose of 200 and something, we're not always that worried about it, because stress can really shoot their glucose up. But in a dog, certainly I'd be very suspicious if we were in the 200s or higher for our glucose. I would be suspicious of diabetes. If it was too low, say his glucose was like 40, and maybe he came in and we took this blood work because he had a seizure. Well, then one of the things that first of all, we have to decide, did we spin it down in a timely fashion? So the blood, we draw the blood, we put it in a tube, we let it clot, and then we spin it down so that the clot is separated from the plasma. If it's not separated in a timely fashion, those red blood cells that are in it will start using up that glucose. So it could be the glucose could be falsely low if the blood wasn't spun down. Maybe it sat out for 2 hours, or it was collected last night and then spun down this morning because it was brought in because someone else drew it or whatever. Then if it was low, I wouldn't even think about that number. But if it was taken the right way and spun down the right way and your glucose was low, that can be a sign that you've got an insulinoma, because you got too much insulin being produced, so your glucose is going too low. And maybe that's, like I said, if he came in because he had a seizure, then maybe that's why he had that seizure, because he was hypoglycemic. Or in a tiny puppy, that's not eating good enough, you could be hypoglycemic, and that would be low. But for the most part, insulinoma, I've seen a few of them, but not very many. So for the most part, your glucose, we're just checking to see if it's high and looking for diabetes. And then your sodium and your potassium, those are your electrolytes. Some of the things that we look at for those are if we have Addison's disease, which is when your adrenal glands are making too much internal steroids, those can be low. While your sodium and your chloride can be low and your potassium can be high. So sometimes that helps us decide Addison's disease, because Addison's disease can be kind of a tricky one to diagnose. But those can also be elevated or decreased with like if we've been vomiting a ton, that kind of stuff. So sometimes we have to take it with a grain of salt when those things are out of whack.
That was funny.
Yeah.
Sorry.
And then going back to the other side, the amylase.
Oops.
So go left. Yep. The AMY. For a long time, when we looked at the pancreatitis namely, we'd look at amylase and lipase, but they've decided that they're not very specific. And so on my tests that I run in-house, I don't even have them on my test because all they're going to do is bring up questions that don't even really matter because they aren't very specific. And if we're worried about pancreatitis, then we have other tests that we can run that are more specific as far as the pancreas. And then same with the glucose. Like I said, say this was your cat and it was 250 and you're like, well, he is really stressed out, but he has been drinking and peeing more. I really would like to know if this is significant. There's a test called fructosamine that we can run that kind of averages it for the last couple of weeks, kind of like the A1C in people. And then that way, one stressful blood draw isn't going to change your fructosamine because it all gets averaged in. And then that gives us a better idea whether or not it's a stress high glucose or not, or, whether it's significant like diabetes. Mostly we use that in the cat, but occasionally we can see it in dogs. What else?
Okay.
Did I muddy it enough?
No, it's good. It's good. Yep. So, okay. I am going to unshare this for a second.
So is that the standard abbreviations for all, like, all different labs that utilize this standard, like the
Mostly.
Okay.
Yeah, like the ALP might say ALKP. But yeah, it's pretty uniform.
Okay.
Yeah.
Good.
So I think for me in the beginning, right, understanding there's a ton of stuff on that paper, but none of them are a vacuum because one thing is high or low, right? It's not super concerning. It's like when you pair it with the other things that are connected with it is when you start to worry about stuff, right?
Well, and it depends on the value that we're looking at. So for instance, with your creatinine, that was your kidney one, 0.1 or 0.2 over the high end of normal starts to become significant. Whereas, like we said, your ALK phos, it could be 2 or 3 times the high end of normal. And unless it's higher than that, we're not going to worry so much about it. So for certain tests, there's not leeway, but where we go, well, we don't care about that. Or in an old kitty with the ALT slightly higher, we don't care about that. Whereas with the creatinine, 0.2, 0.3, 0.4 higher than it was, or higher than the high end of normal, then that is significant. So certain tests are more tightly looked at. I don't know how you'd want to say it, but does that make sense?
Mm-hmm.
Yeah. Well, like I have and I can share this real quick. This is my cats, and you could see. Hold on one second. Hold on one second. And this is, compared to. Oh, let's see what we got here. Speaking of my cat, there he is. All right. Let me find that blood work. Can you see that?
Your calendar, yeah.
No. The blood
I can see your Google calendar.
Yeah.
I don't want you to see that.
Late.
It's scary for all.
Picture.
It's scary for anyone to see that.
I can see your kitty's ear.
Yeah.
Nobody else laughed at that grain of salt joke. I couldn't see the screen. I'm sorry. I was like, that's funny. Come on now.
Why isn't it going?
We're talking about sodium. Take it with a grain of salt.
Funny.
All right. Open. How about that? Can you see that now?
Yes.
Yeah.
Okay. So this is my almost 16-year-old cat. And incredibly, and you could see with the kidney issues. So Therese, you mentioned his kidneys have improved. Go figure that out.
Yeah.
it's still not normal, but you definitely want to keep your eye on it, right?
Yep. But again, in a 16-year-old cat, that it's been going up gradually, they're a lot less likely to be sick than if my kitty was 0.4 yesterday with its creatinine and next week it's 2.4. That would be a sick kitty. Whereas my old kitty that it's been creeping up, it probably isn't even acting sick. But from this you can see that it has improved a little bit.
Yeah. Which is surprising, to be honest, because usually that's not that's not common. But yeah, you can see his those are the ones that in cats that we look at a lot, because he is, he's going to be 16 or is 16 already.
So can you hold there for 1 second? Oh, go back to right where you were, Nance. Page 2, right on top there. I call that new only because it's been, it's only been around for like 10 years. But can you talk a little bit about SDMA and how it's like the precursor to looking for things?
Sure. So SDMA stands for a big long word. I can't even tell you what it means. It's a big long word. And so your creatinine does not start to elevate until you've lost 75% of your kidney function. So for years, we had BUN and creatinine. And if your creatinine was slightly elevated, we're already behind the 8 ball, because we know this pet has already lost 75% of its kidney function. Several years ago, they came out with the SDMA, which can start to elevate with as little as 25% kidney function loss. And so in theory, if you say your SDMA was elevated, but your creatinine and your BUN were fine, then we go, okay, let's look into this, because now is when we want to start changing the diet, putting them on some medications, that kind of thing, because we can't really cure kidney disease unless it's an infection. But we can certainly slow down the progression of it if we catch it early, before that 75% or more limit that we had before. So yeah, it's been a very helpful enzyme or test or whatever you want to call it, has really helped.
Yeah, I really wanted to point that out, because if you guys looked at my blood work, my vet ran it in-house. This is IDEX, right? So this is a send out, but my vet ran it in-house, does not run SDMA. So if I have a 5-year-old dog, it might be something that I'm interested in running. So, or for, like Lisa was talking about, as a baseline, right? Yep. I might want to know that. It's like Therese said, it's going to give you, if your dog might have kidney disease, you'll know long before you see symptoms.
Yeah. Because I ended up, we did some diet changes and all that with the cat, and incredibly it slowed things down, because that's right, Therese, that's all you really can do at this time.
Yeah.
It's just
slow
it down, because it is what it is, right?
Yep.
And I'm trying to really hard not to have to give him fluids, because that won't be fun for anyone. Especially him.
A lot of kitties do really well.
Yeah, well, we'll see. But I'm just making a lot of dietary changes in the hopes that that'll keep him happy for a little bit longer before we have to go there, because I know it's part of it's inevitable, right? It's just what it is. What else I was going to ask you? So for thyroid, you don't see hyperthyroid very much in dogs, right?
No. Hypothyroid in dogs, hyperthyroid in cats.
Right.
People can get either.
Yeah, but if there's ever a hyper in a dog, what would that does that happen does that happen, number one? And I know it may or may not be very common. I don't know.
It probably could if there's other things going on, and then you would just ignore it until you fix the other thing.
Okay.
But I don't know that I've ever seen. The only time that I would see it would maybe be in a hypothyroid dog, so low thyroid, on thyroid supplement. And if they were too high, if their dose was too high,
Okay.
then we would use it to maybe decrease their dose. Or because we want to run the blood when they're on a thyroid supplement, we want to run the blood 4 to 6 hours after they get their morning pill. So if it was too soon, it could be too high.
Right.
And then you'd say, well, but it's only been 3 hours. I'm not going to adjust anything based on that. So that's why we want it between 4 and 6 hours. And then if it is too high, and we want it a little bit high, like
Right. Yes.
4.5 to 5, but I don't want it 7 or 8. And then I would use that to decrease the number. But I don't know that I've ever seen a hyperthyroid, well, a T4 elevated in a dog that wasn't on thyroid medicine.
Okay.
Perhaps it could happen. I
But
don't.
But it's highly unlikely, right?
Yeah, maybe a certain kind of tumor or something, but I don't know.
See, it's a tumor. All right. So what other questions did I have? So don't smack him. Stop.
So I have another question. This is personal preference, so there's no right answer. I'm just curious about your personal, because I am me, and I know probably the three of us walk into our vet's office who hopefully know us by now, right? And we're like when I walked in with this, that's not the only blood work I got. I'm waiting for a couple other things to come back, but I was like, can you please do this, this, and this? And I'd also like you to run a C-reactive protein test, and I'd also like you to run the NuQ cancer screening, and I'd like you to run. Do you know what I mean? Like, how do you feel about clients asking for something and then, telling you why versus like you need to run, right? Like, what's the appropriate way if you're worried about something to have a conversation with your veterinarian so it's doesn't come across offensive?
Yeah. Well, first of all, don't say, well, I read on Google. Right away, that's a little bit like nails on a chalkboard.
The MDs feel the same way.
Yeah. Or my breeder said,
Yeah.
That can be, but well, I'm pretty open-minded, so there probably are some vets that are like, I don't want you to come in knowing stuff that you want me to do because I don't know. I would take offense. I wouldn't. So,
Okay.
It's hard for me to kind of to know, but if you have a test that you want me to run, especially if it's a weird one or a new one, or might even be something I don't even know about, I would be more than happy to run it. I would just have to figure out how or what, or, what I need to collect or where I send it or whatever. I did one, I had a gal, this was back when the whole grain-free and cardiomyopathy stuff came out, several years ago. And she has this giant Malamute. And if you guys think you are hypochondriacs when it comes to your dogs, you are not. So this dog had no signs of anything and had been on grain-free for like 6 months only. But she really wanted me to, I think we sent her for an echo of its heart, and that was fine. But she still was really worried because taurine could be an issue. And so Davis will run a taurine test. And so I was like, Kelly, he doesn't have this. Well, but I would really feel better. Okay, well, that's fine. So we figured out how to do it, and we sent it off. And of course, his taurine level was fine, but it took some research on where we send it, how we, what kind of blood gets sent, all that kind of stuff. But I am more than happy to send out anything, especially if it makes sense. But even if it doesn't, if it would make you feel better, and you're willing to do it, I'm okay with that, because there's always learning too, right? Like I learn stuff all the time. Not when you come to me saying Dr. Google said, but you know, other things.
You learn anything from Dr. Google after your 30 years of vet experience?
Sure I could, but so I think it's a matter of, like you said, if you come armed with why, then the right vet for you shouldn't balk at it. And it may not be straightforward because we got to figure out how to do it or where to send it, but, or what the results would mean or any of that kind of stuff. But the right vet for you should do it. If, you know,
and I'll even go a step farther on that, which is I knew the stuff I was asking for wasn't normal, right? Like I asked for a C-reactive protein test, which is not something people normally ask for. And then I asked for the new Q cancer screening, which I know is very, very new, right?
Yeah.
But what I did, because I knew they were new tests, is I called, right? Yeah, I wish, Tim. I insurance helps with that. Yeah, I looked at the price to get insurance on a Doberman when he was young, and I was like, and now I should have, looking back. But anyway, so what I did was I called the vet clinic like 2 days ahead of time, and I said, hey, this is what I'm seeing. This is what I'm interested in. These are the tests that I'd like to run. You know, can you please add that and maybe check with doc and see if that's okay? And so when I went in, boom, they had it all pulled up. They knew where it went. They knew what to do. They knew what to spin. So it helped with their timeliness as well, right? With the clients after me. So
absolutely. Michael, she might have to pee.
Well, and I'll be honest,
Ray was sleeping and now she's awake.
Yeah, when Chacha was sick, these are other things, and this is why you want to be a partner with your vet and not Dr. Google. Just ask questions like, hey, I had a question about this or that. When my shepherd got sick, you go through that moment of, we should probably do all these tests, and or how do I find out what it is, right? Because we couldn't figure out what was going on. And it really helps when the vet is honest. So you have to respect that, right? Because the vet said, the only way to find out what was wrong with her was to do a spinal tap. And he was very honest, saying that the outcome would have been the same, regardless of what it came, it would just be knowing it. So I opted not to put my dog through that. And because the vet, he would have done it, but he said, but this is it, right? So, and the test, the blood work came back. That's the perplexing was okay. It came out all right, but she was clearly a sick dog. So there's
blood work doesn't tell us everything,
right?
So it doesn't tell us necessarily about cancer. My Tippy, Tippy had GI lymphoma, and her blood was perfect for all 12 years, including the day she died. And she had raging lymphoma inside. So it doesn't tell us everything, but it tells us a lot of stuff about a lot of stuff, and helps rule stuff out, which sometimes, so that's one thing I want to mention too. A lot of times when we're doing tests, whether it's x-rays or blood work, or even ultrasound, sometimes it's hard for you as the client or the consumer that's paying the money. When I tell you this was all fine, and this was all fine, and this was all fine, and we still don't know what's going on, sometimes that's hard to hear. We've just run $500 worth of tests. True. We still don't know anything. Well, except we do know what it isn't. A lot of stuff is ruling stuff out. So everyone needs to kind of keep that in mind and have some grace for your veterinarian, because a lot of what we do is ruling things out.
Right.
And it would be great if I could just run a test and know the answers, but that's not always the case. So, but I understand when it's your pocketbook and you don't have insurance, which most don't, how that can be hard to hear.
Right.
We still don't have an answer, right?
But it does, but it, well, for me, because I'm a little bit nuts, for me, it makes me feel better. Like, okay, it's not that, it's not that. Okay. So then it just kind of, because it is, trying to figure out what it is and what it isn't, right? Because
Yeah.
it's like, it's always nice to know that it isn't certain things. Sometimes that's, even though you may not know exactly what it is, you at least know what it isn't, so that can help too.
Yeah.
And yeah, because the vets are just trying to do the best they can, and yeah, that's why very probably that's more the norm, Therese, than somebody who's like me. It's like, run this test and run that test because I want to know, right? But yeah, I would 100% agree. So let me ask you. And this goes back to the question that Rebecca had. Do do vets usually run like vitamin checks, like vitamin D, magnesium, and stuff like that? Is that a typical? I know calcium is part of the regular test, but
Yeah.
is that
No.
something that they typically would or wouldn't do?
No. No. The one vitamin that we will run might be a B12
Okay.
when we're looking at GI stuff, because you need your B12 for the absorption of your nutrients, blah blah blah, in the mucosa. But no, most everything else we don't look at.
Okay. All right. And would there be any benefit to ask for it? I guess would be the other question, depending on what you're looking for.
The other things, the other vitamins,
Like, say, for example, if you come here,
It's
where it
not
would
for
be,
you.
would it be worth checking some of the vitamin levels, or does that
No,
is that not going to
no.
help you much? Okay, that just was my putting it out there, because it's like I've not heard of that too
No.
much, but I know calcium and the B12, yeah, for stomach stuff, which luckily my dogs don't have, but all right. Anybody have any questions out there? Because we're getting ready to. This has been really, really helpful. Kind of gives us and again, as Joanne said at the beginning of the broadcast, this is so you can be a partner with your veterinarian, not so you can go in there. Therese Simon said, blah blah blah. It's just to understand when they're running tests what it is and what it helps you understand what's going on inside the dog, and then it kind of helps you just partner up with your vet to kind of, if there's an illness or something going on, that you can you'll be better, it'll be easier. It's nice when you kind of understand some of it, right? I mean, we're not, otherwise we'd be veterinarians if we want to understand it more in depth. But but oh, somebody wants to know about blood pressure issues. Do you see those much?
So that's much more of an issue in kitty cats.
Okay.
And one of the things it goes along with is the kidney disease. They oftentimes will have elevated blood pressure. We do look at it in dogs too with kidneys, but it's more of an issue, generally speaking, with kitties. So yeah, it's not as huge of a deal in dogs as it is in us.
Okay. All right.
Yeah, I wasn't gonna say this, but I think I'm gonna. To what I said before Nancy joined, before we came online. So this is just an FYI for you guys. You've heard us tonight call Therese by her first name. Therese is a friend, right? Therese, we go to dinner with Therese. We've known Therese. We travel with Therese. So she is an actual friend of ours. When you guys are going to your vet, even if you've known them for many, many years, right? If you don't have their personal phone number and you don't share time outside of work with them, please refer to them as Dr. Therese or Dr. Simon. They have earned that title.
Yeah.
And so please respect that. Just like all of us, if you called us a behaviorist, not one of us is going to not correct you and say, that's not what we are.
Right.
We did not earn that title. So I just always like to say, right, our veterinarians usually will go 110% above and beyond researching things outside of business hours for us. So
yeah,
absolutely want to show them that respect and the work that they've done to hold that title. So,
right. And it's been a rough couple of years for veterinarians. So that's why we're hoping to help you be more of a partner with the vets instead of that adversarial situation that we that we seem to have about with the vet, with the vets. They're short staffed. There's a lot more of us than there are of them these days. So giving them a little, just trying to be a partner with them and your dog's care goes a lot further, a lot longer, a long way versus trying to trying to give them stress them out and give them a hard time, and just being able to communicate and understand things better is really what we're trying to gain here with our Facebook Live tonight. So anyway,
Yeah.
all right.
Thank you, Therese, for all your
You're
time.
welcome.
Appreciate it very much.
This was great. This was exactly what we wanted to understand a little bit more. I know those of us that drive our vets crazy with other questions. So some of the but other people may be a little too afraid to ask. So we were hoping to just ask those for you, like, what does that mean? So they can at least have an idea. Anyway, thank you so much. Appreciate it.
You're
Thank you,
welcome.
guys.
All right. Bye.
Thank you.
Bye.
Bye.